welcome to another episode. And today we are on two channels simultaneously, both on Oral Pathology 360 and also on Virtual Dental Academy. Of course, both are run by us, so there is not much of a difference. It's just to help that the algorithm on YouTube will find the dental content better if it's on a dedicated dental setting. Now, we come to today's topic and the side effects of cancer treatment, the oral side effects of cancer treatment. When you think of it, I think almost most dentists have either had one or at least know or have a good idea of what it feels to just have an aphthous ulcer. It's a small little thing, lasts for just a week, and yet if you've had one, you know how difficult it is. It hurts, you can't speak, you can't really eat, and you can't swallow, and it's really difficult to have one. And that's just for a week. And for most people, that's just a single one. Now, you think of that many times worse in intensity and maybe going on forever. And that is just the mucositis, the pain that comes with the mucosa. Not talking about all the other things, the xerostomia, the badly decayed teeth, which of course will cause their own pathology. Now, with all this, clearly, these are patients who, in a very bad time in their life, need support. They need support, and for the oral care, they definitely need dentists to be able to support it. And that's what here we are here today to have a discussion with someone who has dedicated her life to just managing and helping these patients. We are very happy to have with us Jill Maya Lippert. She is also one of the marvelous people I found on LinkedIn. Like I keep telling everybody, get on LinkedIn. You'll find very nice people, especially professionally. Now, she has dedicated her life to this work. She is the owner of Side Effect Support LLC, a company committed to assisting cancer survivors manage the oral side effects of cancer treatment. Her mission is deeply personal and professionally driven, motivated by a desire to enhance the quality of life for cancer patients. With Side Effects Support LLC, Jill aims to offer a comprehensive and compassionate approach to care, ensuring that cancer survivors receive the support and guidance they need to address the challenges associated with their treatment. So, welcome, Jill. It's really wonderful to have you with us.
Thank you for the invitation. It's great to join you.
Really great to have you. So, everyone knows how this works. We will watch the lecture and then we will have our discussion. So, please remember to put in your comments and your thoughts and your questions in the comments. We will deal with them in the order they appear at the end. Also, I would really like to know, and if you can, type in and see, let us know if you have had any experience with someone who's had these cancer side effects anytime. Yes, we will now watch the lecture and then get back together again.
Well, thank you so much for joining us. I want to start out by reading you some posts from a closed Facebook group that I am a member of that is for survivors of head and neck cancers. The main post, and bear with me, then I'm going to read a few comments that follow it, is I'm so sick of my teeth, going for my 13th root canal. I wish my oncologist would have recommended the upper teeth come out with the lowers. And some of the comments that followed were, "You're not alone. My oncologist told me nothing of this. Mine started breaking like chalk, and I have dental insurance, but it only covers $2,000 per year. And as you know, it costs a fortune to get bridges or replacements, let alone the pain." Another comment was, "Not one of my doctors warned me to see the dentist before radiation. Not my ENT, PCP, radiation oncologist. I found out through an American Cancer Society head and neck forum." A couple others that followed is, "I fought it for years, root canals and everything, trying to keep my teeth. Waste of time and money. I now have 3 on the bottom, and that's all. Tried 2 sets of dentures and couldn't eat. I'm now on a feeding tube. Wasted all that money. 14 years ago it started." And the last two are, I wish we'd known this before my daughter started radiation. My dad is on year 3 of chemo for colon cancer, and his teeth are a mess too. And finally, I think this one really jumps out at me is mine are all breaking and crumbling. My dentist at the start of this had said, oh, it'll be easy to maintain your teeth, no worries. Then after radiation, he tells me it'll cost $8,000 a tooth to save. That greedy bastard set me up. So I think that last statement really just always struck me. Was that man's dentist a greedy bastard who set him up? Probably not. Hard to say. I don't know this person, but I would guess that this dentist did not fully understand or appreciate the challenges that this patient was going to be facing. And because of that, was not able to provide that patient the guidance and preventive services that were really necessary to help minimize some of these effects. And unfortunately, this is something that is far too common in this particular Facebook group. There are many different posts that are similar to this. And as part of my services through my company called Side Effect Support, I do a lot of presentations for patient support groups. And it is pretty consistent that I will have a patient ask during these meetings, how do I find a dentist that fully understands and appreciates the challenges that I'm facing? And it's heartbreaking that there are so many patients that are feeling lost. They're feeling like they're not being provided true care in this area and not getting the information they need either from their medical side or from their dental side. And this was something that I recognized very early on in my dental career just because of family experiences and seeing, in particular, my mom as she went through breast cancer treatments and the lack of information that she was provided on the oral side effects. She had terribly dry mouth to the point that she would choke because her tissue would stick together. Her oral mucositis was incredibly painful, and she really, when she went to her oncology team to ask what she could do, they basically shrugged their shoulders and said, it's just part of treatments. You just need to deal with it. So this is a common thread. And this really lit a fire in me early in my dental career to want to learn more and try to fill this need for patients. Because it is not only during the treatment process that patients are not getting the information that they need or the preventive care, but it's also through their survivorship years, because a lot of patients are getting through their treatments only to have a lot of damage done to their oral health. My battle cry basically is we need to recognize patients' challenges, the side effects that may occur for them as early on in the process as possible, and take what their medical history is, take what their diagnosis, their treatment plan, the possibilities of those side effects, and put together some type of plan for them so we can get them on a proactive, preventive protocol of some sort to help minimize these risks. And the fact is that as patients go on through the treatment process, as they get further into the process, it's more likely that the side effects will be more severe as each treatment comes. So if we can minimize their onset and delay that in some way, we can help to prevent how severe that they will get. So in the ideal world, the dental team would be part of their cancer care process. And unfortunately, that's just not the case for a lot of people. And a lot of that depends on, the area that they live. If they are getting their treatments done at a large, metropolitan city hospital, teaching hospital, sometimes they will incorporate those other disciplines in it. But for a lot of us that live in more rural areas, that isn't an option, and it isn't something that's offered to patients. So we would like to form some type of relationships with the other providers in our community. So reaching out to your oncology teams and saying, hey, I know that your patients do need to have dental clearance at times before going into treatments, to make sure that they're not entering in with any active decay, any active infection, while their blood counts start to diminish during the treatment process. And building those relationships that you have oncology members that know that you appreciate and understand some of those challenges can help to give some type of referral basis and hopefully get these patients to be seen and have their treatment done before they start their treatment process. Once they begin treatments, a lot of times our hands are tied. Once their blood counts become more fragile, we may need to only be seeing them on an emergency basis until they are through treatments and stabilized medically. And by that time, a lot of damage can occur. So if we can get them in as early as possible, it's really important to take very thorough records, not only to check for any immediate needs, and of course, our main goal there is to get them stable in some way. We're not going to make any major treatment plans at this point, but to remove any decay, remove any infection, remove any teeth with poor prognosis, to make sure that they aren't in a situation where they need an extraction after their blood counts have been affected. And then make sure that our records are showing the condition of their mouth, so we have some documentation to show if there has been damage that occurred during the treatment process. And that can be really important for them, years down the line through their survivorship with having, insurance coverage or other types of coverage to help pay for some of their dental care. It's also important then to take baseline readings of, and I'll just use as an example, let's say we're going to be seeing a head and neck cancer patient that's going in for radiation. And because of their treatment plan, we know that trismus may be a risk factor for them. So that's a perfect time is to take your records, to check their maximal incisal opening, check their lateral excursions, make sure that we've got great documentation of what kind of mobility that they have in their jaw movements. So if we notice down the line that there are some changes occurring, that this can be addressed early, because this onset can start months, a long time actually, after treatments have been complete. So we want to make sure that if there are any changes starting, that we get them in to see any other types of healthcare providers that can help minimize this. And this can be, again, partnering with other types of professionals in your area, massage therapists, physical therapists, sometimes a speech and language pathologist, people that can help to give them the exercises they need to keep those muscles pliable. So if we get them on these preventive protocols, a lot of that is also their oral hygiene. Somebody that goes into treatments with a lot of plaque and tartar buildup is more likely to have oral side effects, to have infection that occur. So it's really important that they understand to keep their mouth very clean. One of the resources that I'd like to share with you all is that on side effect support, I have a resources tab, and we have free printable patient brochures that go through the simple side effects, the dry mouth, mouth sores, along with the tips that they can use at home to help minimize those with their oral hygiene routine. And that is one thing that these side effects, these complications are they're complex, and unfortunately sometimes because of that, the really, really simple things that we can do just fall through the cracks. So one of the things is looking at what kind of toothbrush they're using. All patients that are going through treatments, you're going to want them to use an extra soft compact head toothbrush. And most of the toothbrushes they're going to find in the store are large, and they've got stiffer bristles, and that's going to make it more likely that they have toothbrush trauma. It's going to make it more likely that they can irritate the tissue to initiate oral mucositis, or they just have a hard time brushing because their tissue is just too tender. So keeping an extra soft compact head toothbrush that they can use, letting them know that the softer the bristles, the faster it's going to wear out. So keeping an eye on those bristles, that any bending or fraying that they toss that and get a new one because that will make cleaning more difficult. There are a lot of other specialty brushes that are on the market that are really tiny. Some of them have nice little hooks on the end. They're extremely soft, and this will help to keep brushing more possible throughout the treatment process. A lot of patients will be told by their oncology team to not floss at all, which seems counterintuitive. But if somebody is a flosser and does a really good job with it and is coordinated enough to not cause tissue trauma with it, typically they can continue flossing. If their blood counts drop to an unsafe level, then they may need to alter their technique a little bit. And as they are wrapping it around the tooth, just to not go into the sulcus area to avoid any uncontrollable bleeding or introduction of a bacteremia. So, but if you have somebody that has not been a flosser, when they start treatments, that isn't necessarily the time for them to start because they can sometimes cause more damage than helping themselves. So again, brushing frequently with an extra soft compact touch toothbrush, looking at the toothpaste that they use. There are many different chemicals in a lot of over-the-counter toothpaste that can be an irritant to their tissue and may initiate that inflammatory process for oral mucositis. So a big one to look for is the detergent sodium lauryl sulfate. And that's a really common one that are in a lot of toothpaste, a lot of other types of soaps like laundry soaps, bath soaps, hand soaps, things like that. And this is a skin irritant for many people. So avoiding those types of detergents, also avoiding any alcohol. Years ago, I know we, in dentistry, a lot of times had this concept, we're just going to kill all these germs. And unfortunately, when you're killing the bad bacteria, you're also killing the good bacteria. And we really can throw that oral microbiome off per patient by being over aggressive with their antimicrobial agents. So there are also simple salt water and baking soda rinses. We do have a recipe for that in here that they can use as often as they want. And it helps to kind of neutralize the pH inside of the mouth, can be very soothing to the tissue, help to reduce inflammation in the tissue. And it's also good to get them started on, do some vetting of products yourself. And if you can help to provide them some of these things that they don't have to go looking from the store to store to try to find them. And I'll just show you an example. This is actually a kit that I worked with a hospital here in the States that we put together these kits for their patients. And as they start treatments, they go home with this and they're able to start using things right away. And that way they have everything on hand and they can use this before the problems start. And that can also help to reduce their risks rather than waiting for the side effects to start and then you're trying to put fires out. So I also do have a communication sheet that I will share a link to. And it is something that your administrative team can use if they are taking a call from a patient or from an oncology team to help gather the information that you need so that you have the information to treat them safely by the time that they're in your chair. Because we need to make sure that everything that we do is done in a very timely manner, because we can't have their treatments delayed at all because of us not being able to get them in on a timely manner or fit them into our schedule. So we always have to be very mindful of that treatment time process and keeping them on schedule as much as possible. So those are probably, the biggest takeaways is getting those patients in early in the process, having very thorough records, getting them stable as far as their oral health as much as possible, educating them on their risks, and doing this in a way that is not scary. We don't want them to be going into treatments afraid to go in because of the problems that may happen in their mouth, but we need to be realistic about it too. And one of the ways that I like to do that is by saying, okay, these are the risks. And if we know that that's a risk, let's just be proactive and start doing things now before they even start. And hopefully we can, even if we can't avoid them, we can hopefully minimize them, and addressing things like that it's in a non-frightening way. Making sure that they have the products and the tools that they need, and then that follow-up. Keeping that communication, even if you can't see them during the treatment process, we still can reach out. Are you having any problems inside of your mouth? Giving them that counseling, and if something does start, that we can do something to address it early on, and hopefully avoid a lot of that long-term damage that can occur. And then also just recognizing that as survivors are going after years after treatments, that just because they're done with treatments doesn't mean they're done with all the effects that have happened to them. So being mindful that we have patients that will have long-term challenges, and it's important for not only the clinicians to understand that, but also your administrative team, because a lot of the patients will mention that to me too, that they feel judged, and they feel like people, it's not only the clinicians that are not understanding, it's sometimes the administrative team that is making comments about them not following through on things the way they should, or things like that, and not really understanding their challenges. So I hope these are helpful. If you go to sideeffectsupport.com, I have two sections of blogs. One is for patients that has free information, and it's many, many pages of free information in more layman's terms. But I also have a professionals section that is meant to help get medical and dental teams more on the same page with the information. So then there are several pages of free information, and you can actually narrow it down. There is a filter by bar at the top, and if you put different subjects on the top, you can filter and kind of narrow down the subject matter for those. There's also the free patient brochures under the resources tabs, and then we do have links and to other products and things like that if you're looking for suggestions for your patients. So please feel free to reach out anytime. My email address is Jill, Jill, at sideeffectsupport.com. And I hope this is helpful for you and your patients.
Thank you, Jill. That was a very, very informative and very interesting talk, and very to the point too, which was great. Now, just reminding everyone, you can put your questions and comments in the chat. And also, if you like the content, if you like the lecture, please remember to hit the like. Now, in the meanwhile, while you do that, yes, we shall see what's happening. Let me first say hello to some of our regular. Yes, hello, Dr. Nasser and Dr. Bhuvan, Dr. Shelley. We also had Dr. Karna on the other channel, right? And a whole lot of others who have not put in their names, so I don't know who's there. Okay, now, okay, we have already got a question. What do you see? Dr. Gupta is asking, respected ma'am, can fungal growth be a side effect, especially with candida? If so, what precautions can be done and what care and treatment modalities should be done?
Yes, the oral candidiasis is actually a huge risk for patients, and that can get very severe. That if it would go down into the throat area, could be very dangerous for them. So we need to be monitoring for that. Number one, one of the biggest things you can do is really treating that dry mouth. The drier their mouth is, they're going to be much more at risk for that happening. So working with the oral moisturizers, I personally like working with oral moisturizers that are xylitol based. And I actually do have an article on in the blog on my website that there looks to be that there's some indications that xylitol may help with the oral candidiasis, or at least preventions of it. So I do think that really helps to make a healthier oral microbiome when you use xylitol-based products. But probably the biggest thing is having the awareness that the patient understands what to look for, that if they notice anything starting, to make sure that they tell their physician right away, that we can have some of that antifungals added. But there are some cases where I've been to some oncology departments that they will automatically give them a version of the mixed medication mouthwash, the Magic mouthwash, that has an antifungal in it, almost as a preventive agent. But some of those can actually contain sugar. So you don't want them necessarily using those types of rinses unless it's necessary.
Yes, very true, because dental caries is another big problem, of course, with reduced saliva and all the medication.
Yeah.
So, okay, let me take this away. Now, when we were discussing earlier, also, like you mentioned, that if the patient has not been flossing before, this is not a good time to begin.
Correct.
But nowadays, a lot of us have come in contact or know and are using water flossers like Waterpick or basically variations of it. What do you think? If someone has not been flossing before, is it safe for them to start with the water flosser?
Well, and in full disclosure, I actually have started working with Waterpik as a professional educator. So I am a huge fan of Waterpik water flossers. Those are also something that needs to be used in respect to blood counts. As far as the research goes, they don't cause any more of a bacteremia compared to regular butt brushing and flossing. But anytime those white counts are too low, or if the platelets are too low, we have to modify oral hygiene in some way just to be as gentle as possible to prevent risks for uncontrolled bleeding or introduction of bacteria into the bloodstream.
That's true. You know, one thing I've always realized, there was a like you were telling about your mom, but some time back, uh, a relative of ours had who was already a cancer survivor. She had cancer of the breast, had gone through the treatment, and she was fine. And then she developed a secondary in the mouth, so that had to be treated, and there was radiation therapy. But the radiation side effects were so bad, she could not eat. She lost something like 15 kilos during 2 cycles of radiation. She became so weak that we had to stop the radiation, because whether or not the cancer would, but the radiation was about to kill her. And the physicians, I mean, they just said, oh, we can't do anything. This is just part of it. Exactly like you said. This is
Mm-hmm.
just part of it. What can we do? And I think that's really very sad if someone looking at a life saving treatment has to stop it because, well, they're not able to bear it anymore.
Right.
That's really sad.
Well, and that story is actually hits home for me as well because my dad had two different types of cancer. He had chronic lymphocytic leukemia for many years, which was a mild case and very manageable, but later on developed Hodgkin's disease. And after his diagnosis, they started chemo, and it started just a whirlwind of emergency room visits and blood transfusions and hospital stays and isolation with neutropenic precautions. And, we dealt with that for, I want to say, maybe like 4 months until the oncologist took us aside as a family and said, we need to make a decision because he's too weak and he will end up dying from the treatments, or we can just stop the treatments and let the cancer run its course and hopefully give him some quality of life during that time. So that was what was decided. And but that was that certainly made the whole concept of the importance of side effects and quality of life. And it's not just about survival; it is about trying to maintain some type of quality to their life during the treatment process and also through their survivorship years.
That's very true. It's sad to hear that. Yes, it is really, really true, because otherwise, and some of this is very easy to take care of, like we were just talking. Very often, people, I think, maybe even dentists themselves, don't really realize the importance of the part we play, or more accurately, the part the mouth and the facial-maxillary region plays in so many things, whether it is social or bonding, whether it is eating, which of course you need to eat first and foremost for nutrition, because especially during the treatment, but even otherwise, the time you spend, the quality time you spend, being able to eat with family and friends, being able to smile, to talk, is also much a part of our life. And if we are not careful as dentists to help, and if we don't get the patients early enough to help them, I think patients will lose on almost all of these at around the worst time of their life, which just
Yes,
makes it worse.
it is. And as we were talking a little bit earlier, before that, there's actually a large segment of the head and neck cancer population, especially that deal with a lot of depression issues. There's a higher suicide rate for this demographic, and a lot of that is surrounded around all of the after effects that they deal with. And it is the socialization issues, the disfigurement that can come along with it. And I had been doing some research for an article recently about the value of your smile, and talked also about employment opportunities that you know cancer can be just devastating financially to an individual, a family, and if somebody loses that appearance, how that can affect their ability to even hold a job later or be hired somewhere. So there's so many factors that you don't always think about that really are issues for people.
Yes. Okay, we got a whole lot of other questions, so let's get with those. Right. Dr. Mala says, good day. And do you think the use of an electric toothbrush can help more with with
Like
control?
pest
Right.
control.
Oh,
Yeah, the
plant
electric
control, you're right.
toothbrushes can be very beneficial, and especially I think for our survivors. If they're out of treatments and they're not dealing with the blood count issues, and they don't have to worry about maybe using something a little more aggressive with their, that can be really beneficial. But I would still look for some of those same features. Using that small compact head, one that has nice soft bristles, that it's not going to be too aggressive with the forces. And then a lot of them now have different intensity modes on there, so the patient can actually adjust how intense that those vibrations are and make that a little bit more unique to what their specific needs are.
Very good. Yes. Good question. Good answer too. We have another one from Dr. Vivek. Yep. Very informative lecture giving a new insight on this topic.
Thank
Definitely,
you.
I'll be able to educate my patients more effectively. Yes. That
I
is
appreciate
really
that.
the whole idea to get everybody working and thinking about this. Okay, Dr. Daniel says one of the biggest obstacles in the management of oral side effects of cancer treatment is the pernicious traditional gap that has existed between the medical and dental teams, rooting right back to the universities. That is
Absolutely.
so very true.
Absolutely. And I think sometimes that is, like I mentioned about reaching out and trying to bridge some of that gap within the doctors, the other disciplines in your community. So whether it be reaching out to the physician's office, letting them know you do understand it and you're here as a resource for them, because sometimes they don't know who to refer patients to or who to ask if they have questions about the mouth. And if you can be a resource for them, it helps to start building that mutual respect. And then you can start building that team of other disciplines, of your physical therapist and your acupuncturist and your massage therapist, and people that you can call on when you need them too for some advice or somebody to refer to. But that way you know that you're finding people that you can work well with and that you can trust, and that you know that they'll do a good job for you and your patients.
Very, very true. Okay. We also have Dr. Madhu Shankari. Hi, Madhu. Okay. Yes. So, absolutely true. It would be really a very important part of patient care. Then Dr. Malas first said 100% agreed with Dr. Calvin, and then says, unfortunately, oncology team and other physicians always underestimate the seriousness of oral side effects of chemo and radiotherapy. That
Yes,
is very
that
true.
is 100% true. But I think
Yes.
I think some of that, depending on where you are also is changing. We do have more and more evidence of the oral systemic links. There are more hospital programs that are implementing some very basic oral care protocols into their systems and really getting amazing results. And sometimes, as the word starts getting out more about that, unfortunately, a lot of times for these hospitals, it's the money saving aspect that will, in the end, make the biggest difference for them, which is unfortunate to say, but reality. But when they see that there are fewer people coming down with hospital acquired pneumonia, fewer people going to the ICU units, having better treatment results, and then sometimes how that helps with their insurance coverage and things like that. There can be ways that eventually that light bulb starts to go on, but unfortunately, we're not quite there yet everywhere. There's more and more hospital systems that are implementing things, but there definitely needs to be more.
It's going to take time.
It will take time,
Yes, it's
definitely,
going to
but at
take time.
least it's starting.
It's starting, exactly.
Yeah.
An interesting thing what you mentioned about the hospitals and insurance, and it makes me think um, maybe we should attempt connecting with the insurance directly to let them know that if this becomes a part of the treatment, they'll end up paying less.
And there are actually a couple insurance companies that I recognize as that as well. One that comes to mind is Aetna has a program called Rush to Brush, I believe it's called, and they do actually implement one of these systems, kind of similar to what I have, where they have a kit and they try to educate the importance to the nursing staff of oral care, because unfortunately that is something, if somebody is admitted to a hospital situation or in any type of a long-term care facility, that is usually something that just for many does not even get addressed. Many people don't even have toothbrushes or oral care products provided for them, and they just don't even have any options for cleaning their own mouth. So, and if the staff doesn't understand, that certainly means that the patient many times doesn't understand how much they can protect themselves just by simply keeping their mouth clean.
Quite. And it can be quite an uphill task, I can tell you firsthand. Even when my own experience of being in the hospital, as a dentist, I wanted to obviously clean my mouth, but there was just no way. And finally, I had to come down to just using a mouthwash, but even that was with some difficulty. So, yeah, it can be difficult. And sometimes there are so many other things that possibly take precedence, I understand. But still, if the more we manage to get the medical team to understand how important it is, not just because we are fanatic about saving teeth, which we are, but that's okay. I'm sure they're fanatic about saving patients in whatever way, but also because it finally works for them and in whatever treatment they're doing, because the patient will have less number of other problems and infections. Yes, we will work on that.
Yes, and there are some cases, even locally, of situations where I've known people that have gotten to the point of they were going to be going in for bone marrow transplants. Something so severe where their immune
So
system
true.
is completely wiped out, and nobody from their medical team said anything about making sure to go in beforehand. And typically there is a window of time. There's
Yes,
usually people
there is
don't
some
go
time.
immediately from
Yes,
diagnosis into treatments. I mean, with certain blood cancers, you might,
yes,
but most people do have some bit of time that having a referral should just be more of an automatic thing. And I think the nurse navigators, honestly, are some of the really biggest areas to target for this education, because they're going to be the ones letting that patient know what their plan is, and they could incorporate that right into their system a little
system.
easier.
Exactly. True. Because obviously no one goes for such complex treatment without a whole battery of tests and this there's a whole process, and the process can take time. In that much time, definitely you can I mean a dental treatment and dental checkup to begin with at least can be a
Mhm.
part of the whole process. Yes. Okay, let's see what's our time. Yes. We have some more time. So any other questions anyone has for Jill on what can be done? But I like your idea of approaching the physician, especially we know it is cancer, so it's not you have to go to every physician around you. You have to go to the onco team, the onco surgeons, and the onco physicians, and the oncotherapist. And it makes sense. And very often there is a whole cancer hospital close by. That makes it even it's easier is to just go there and to let them know, yes, we are here, we will help. That makes a lot of difference. It's the first step.
It is, yes. And I think if they know that there's an option for them to refer to, that a relief on their end, because I've heard other medical, the nurses, and say that they don't know where to even send patients if there's an issue. So even if it's just a teledentistry type thing that you could implement within your practice and giving uh, remotely giving them some advice and helping them triage. That is something even on side effect support that I was really fortunate to partner with a group called the Teledentist. So anybody can go on my website and actually access a teledentistry visit within 10 minutes or less. And the concept around that really was if somebody doesn't have dentists to go to and they have a concern, if they perhaps have an emergency situation, that this can help triage the situation, hopefully help prevent an emergency room situation, something like that.
Yes.
So there's definitely a way I think teledentistry can really be a great asset for making those connections and providing that counseling.
Very true. But now, before some of our younger colleagues attempt it and get disheartened very fast, I think we should also tell them that uh, you have done this for many years to get the response that you want. So sometimes it can take time.
Yes. So I started my first job in the dental field in 1992, and that's when my mom was diagnosed. And that's when that light bulb went on for me that there's just a need that's not being met here. So it was a struggle through many years to try to even have access to this information. And I think that was one of my big goals with side effect support too, is I wished through the years so much that I had some type of a resource to turn to. And finally, I thought, well, if it doesn't exist, why don't I make it? So that was the goal: is just making something that I wish that I always had when I was trying to learn more about this. And there's many more researches, but there's so many different ones that if you can go to one central hub and just cut down the amount of work behind having to search for all of these things, it just makes it easier for everybody and hopefully gets better results and more timely results for everybody.
Very true. Okay, I think we have no more questions. So, yes, we are done. Anything you want to say as the closing remarks?
Oh, I just appreciate everybody taking time to tune in and your interest, and I'm very grateful for the nice comments that were provided.
It was a very timely and very useful lecture, I must say. Okay. Okay, we got one more. Thank you, Dr. Maria Pagola. Thank you very much. Oh, Argentina. Greetings. Yes, greetings to you too. So, let me give you a little token that we give everyone who comes on the channel. Is a little certificate to say thank you.
Thank you.
And yes, so
I
yes, I
appreciate
forgot
that.
to do that. Yes, thank you so much for being with us. Like I said, you have been one of my uh, most significant finds on, on LinkedIn because I have been looking for someone to do this for years. I can't tell you for how long. So I
Oh, I
was really
appreciate
so
that.
happy to find you.
Same here. I'm happy you found me too.
Great. And I hope we will meet again soon and you will come back and give us more talks. And I wish you every success. And I would put all the links that Jill talked about all the content and her website on both our channels. And so in the video description, and you all can access it. You can also find her on LinkedIn and you can connect with her. So I do wish everybody a great time. And with this, we shall say bye. Everyone have a safe week. Of course, we will be back on next Tuesday on our regular channel. That will be only on Oral Pathology 360. And we shall meet you then. Till then, be well, be safe, and see you.
Bye.
Bye. Bye.